Now to some uproar, this time from the Council of Governors, who are accusing the Ministry of Health of sidelining them in the preparation of the 4 crucial bills which will guide the process of implementing the universal health coverage. In a meeting with Health Cabinet Secretary Susan Nakhumicha and other top Ministry of Health officials, the governors, led by the COG chairperson Anne Waiguru, say counties were only involved in drafting of the digital health bill, which also failed to capture some of the key issues they say they raised. The governors now want their input factored in the bills before its tabling or before their tabling in Parliament.
The third day of stakeholders' engagement over the 4 bills to spearhead the implementation of the universal health care. Health Cabinet Secretary Susan Nakhumicha met with the Council of Governors to discuss the bills which, if passed, will largely depend on counties for implementation. However, even before the start of the meeting, county bosses raised what they deemed as late consultations by the Ministry of Health on the bills which counties should have been co-drafters.
Are we recipients? Are we just part of public sector or what we call stakeholder engagement? Or are we supposed to be co-drafters of these particular bills?
The governors say they were only consulted in the drafting of the digital health bill, which will give powers to the cabinet secretary to be in charge of the health data, but were kept in the dark in drafting the social health insurance fund bill, primary health care bill, and facility improvement fund bill.
The failures of UHC has been because of lack of good legislation, good legal framework. Again, I don't want us to fail because of just simple things of consultation.
Your legal team and our legal team, which have not sat anywhere, should have sat and agreed on these issues before they go out to the stakeholders, unless we are being treated as stakeholders.
Some of the concerns raised by governors is the issue of Cabinet Secretary owning all the data, which they propose that all county health data should be with the county. Another concern is the clause that seeks to make national legislation prevail over county legislation on the implementation of the Facility Improvement Fund Bill, which they say is unconstitutional. On the proposal to convert community health promoters into workers, the governors say this will have serious financial implications and also feel that they're underrepresented in the Social Health Insurance Board.
I'm seeing a standoff. If you give me a bill or an act to employ 1,695 workers who are CHPs, I cannot do it because of the resources. On your legislation, make it broad and a policy-based law that gives the room to the counties to be able to specify certain levies and fees that they may want to charge in public health-related fees.
Concerns that the ministry says will be addressed before the tabling of the final draft before the National Assembly.
These bills have not been developed from nowhere. They have been developed from existing documentations, and the existing documentations have been worked on together with COG. So believe me that your voices are already in these bills, but agree that we should have more time for consultation.
Technical teams drawn from Ministry of Health and COG have been tasked to iron out the outstanding issues before the lapse of the public participation, expected to end by September 19th.
Partners.